Man, I wish I could lower my hairline. Let's talk about the pros and cons of hairline lowering surgery using grafts. The great thing about hair grafting is that it's a much more minimally invasive procedure compared to hairline lowering with a scalp advancement. You're able to shape the hairline however way you want. You can fill in the temples, you can fill in the sideburns, things you just cannot do with a hairline lowering using scalp advancement. Another advantage, obviously, is that there's no actual cut being made on the forehead, so you don't really need to worry about a long scar. What are some of the negatives? Normal hair density along the hairline is anywhere between 200 to 300 hairs per square centimeter. Even after numerous attempts at hair grafting, the closest you can get to that is maybe half the hair density. For people with dense hair, there's going to be a noticeable drop off in density between your natural hairline and the newly implanted hairs. Another negative is that the graft uptake rate in forehead skin is just not as high as in scalp. Forehead is thinner, it's not as vascular, and the graft survival rate is much, much lower. Another negative is that you only have so many grafts available. So if you use them all to try to lower your hairline significantly, you might not have any for potential touch-ups in the future or needing to compensate for future hair loss. So times where I would do hair grafting instead of a scalp advancement, if I only needed just a little bit of a reduction, maybe about a centimeter or less, or if I needed a lot more in my temples and in the center, or if you have very low density to begin with. I hope this information was useful. Let me know if you have any questions and I'll answer them.